May we then turn to item 5 on the agenda, again another hugely salient issue for us, which is the patient and public voice. I'm going to invite Tim Kelsey to introduce the paper.
So I think it's just worth reminding the board that the document that Bill's been talking about is of course called NHS. The NHS belongs to the people, and there's a very important discussion which we've just had around the future and how we develop it for the future. This paper is really trying to describe how we're doing it right now, and this radical view that we have as a board that of the urgency with which we need to transform the way in which patients, the public, citizens at large, are fully engaged both in their own health and well-being and more broadly in the planning and commissioning of services is something we have to get on with right here and now. So without going through the whole paper, I just wanted to draw attention to 3 or 4 things which I think are unprecedented and I hope are more than symbolic but real statements of intent in genuinely putting the patient, customer, the public at the very heart of everything we are doing. The first of those is just to highlight for people, we've seen the film, the very deep importance of the work we've done in encouraging and working with the professional associations to publish data in 10 surgical specialties, which was launched last month. It is the first time in the world that there's been that level of transparency. We're working now with those specialist associations to make that data even more accessible so we can imagine a range of sort of tools and services which people will be able to access online in a way that just hasn't been imaginable before, to really and not just make choices but to have a different kind of conversation with their doctor about the course of their treatment. The second very important statement of intent around transparency will be with the publication of what we've called the Friends and Family Test at the end of this month on July the 30th. This, in effect, for the first time, is offering everybody in our community the opportunity to take a TripAdvisor type approach to rating their local hospital in this instance. And 100% of hospitals in England have invited their patients to describe whether or not they would recommend that service to a friend or family member. And the services we've started with are in accident emergency and in overnight inpatient stays. Those will be published, say, in July on NHS Choices and elsewhere, and I think this will completely transform the kind of nature of the conversation that people have about the quality in healthcare. We've relied historically on pretty patchy data on clinical activity. We're now opening up the conversation to be about just what other patients have experienced at the in different institutions, and just to make the point that we're committed to a very dramatic programme of rollouts across the NHS. So by the end of next year, we will have launched the same programme in primary care and in community care and also mental health. And by March of 2015, every NHS service that's commissioned by NHS England will be required to report the Friends and Family Test measure. So that's, in a sense, capturing the transparency component, and there are other things in this document I hope speak to the same theme. But just to move on to the other core operating principle of NHS England, which is participation, there are a number of important initiatives underway. The first of which I think is, we mentioned before the importance of being an exemplar in our commissioning of the services for which we're directly responsible. And it's not just the commissioning that we have to be an exemplar, and it is the involvement of the public and the patient as well. And just to report to the board that I think we've made some very significant progress working with colleagues in Bruce's team and elsewhere in the board on putting the patient voice genuinely at the heart of specialised commissioning. So we now have many hundreds of people being involved in actively designing services with clinical colleagues, and I think it's been a very big step forward for genuinely, properly putting the patient voice at the heart of designing services. Also point to a lot of work that colleagues have been doing in relation to sort of unleashing the power of technology to really enable people to take more control for themselves. So as board members will know, we have a very big programme to give every citizen in this country the right to access their online primary care record from March of 2015, and the numbers of people able to do that now are very close to 40%. So we've made some very significant progress in getting people at least giving them the offer of that opportunity. We've also relaunched the programme to allow people to be able to book appointments in hospitals conveniently from their home, and that's been another big step forward. And then finally, Victor has been leading work for the board, which I've been supporting, looking at really how NHS England, as an organisation with such enormous responsibility, can build meaningful networks in the community at large, so that first of all it can be held properly accountable by the people it's serving, but also so that we can listen better to what the broad, the broadest community we can is telling us about how we should be conducting our work. And perhaps I would invite Victor just to say a few words about that.
Myself and Kieran had a very powerful, I thought, very useful day in which we invited a whole load of organisations, including Healthwatch, and we had 38 Degrees, we had National Voices, to start looking at how we design this vehicle. It's been called the Civil Society Assembly, but actually it might be called something else, hopefully something positive and creative by the time we finished with it. I thought the day really produced a sense of, the question we asked was, is it possible for NHS England to have the public, as consumers of what we do, hold a mirror up to us and tell us how are we doing it, what's their experience when we talk about community commissioning and all this, what's the experience of it? And that was the question. And I think the answer was, yes, we could do this. We could possibly do this. And certainly judging by the live tweets, there were people tweeting. It was an actual aviary of tweets throughout the day. I think the answer is yes. So we look forward to the next cycle and actually opening this up to a wider group of the public to really get engaged and, I hate the word, but empower them to tell us what it feels like to be part of the growing NHS England influence and environment. I don't know whether Kieran would like to.
No, I completely agree. I think it was a very good day. I think one of the things we have to get right is, if we're inviting people in to talk to us, we have to listen.
We do.
And we have to act on what we hear. And that message came across very strongly, I think, and it links into the call to action work. We really need to do that properly and be seen to do it well. The other side of it is, it's not a binary conversation. Now we're talking to patients and the public, and now we're talking to clinicians. It's around having them in the room together. And the conversation we had yesterday around specialised commissioning, having been a big critic of the engagement of specialised commissioning with patients and the public, I think hearing yesterday how some of that co-creation is really making a difference, I think was very, very positive. And this thing around, actually, we come up with better solutions when it's everybody in the room together. So, great first steps. More of the same, please.
Thank you. I think there's one very interesting point about the whole move towards transparency and the use of data. And it comes against the newsworthiness of the NHS. What's newsworthy and politically salient is when we discover something we didn't previously know about the NHS, and that's a scandal, and it gets widely reported and creates scenes in the House of Commons. If as we drive through this programme, it becomes possible to have data at our fingertips and at the fingertips of patients the whole time. We can see how the system is performing, what the trends are up and down. Then you take away that element of surprise. It's possible to monitor an ecosystem which is performing and identify where further effort is needed to carry out our obligation of securing continuing improvement. But I do see the opening up of the system as a way of taking away the element of political and newspaper scandal, focusing much more on the outcomes and the interests of patients and empowering patients, and lowering the temperature, which allows us to look forward over the next 10 years and in a more open regime that's more accommodating for change, because the reasons for change can be seen more transparently. Right, thank you, Tim, very much for that paper. Let's move on then. I think we're going to talk to us about the petitions log.
Very brief. We, as an arm's length body, encourage members of the public to petition us on particular issues. It's an important part of our of the democratic process, I suppose. We've had just a note. I'll circulate a paper to the board, which we'll put online as well. We've had 3 petitions so far. We've been in touch with all the correspondents, and those petitions are live and gathering signatures. They largely relate to very specific issues of local service delivery.
Okay, thank you. We note that.